Is your teen living with pain every single day? However, your doctors keep saying there's nothing wrong or keeps giving these mysterious diagnosis. So maybe it's their legs, their back, their head. You've done PT, MRIs, and pain meds times 1000, acupuncture, chiropractic, you name it. You've done it all. However, your child's pain is still there. So maybe you have got this diagnosis of headaches, persistent headaches, daily persistent headaches, migraine, amplified musculoskeletal problems, amplified musculoskeletal pain syndrome, AMPS, complex regional pain syndrome, CRPS, or FND, functional neurological disorder. So in this video, I'm going to walk you through what's going on with chronic pain regardless of the diagnosis and where the pain is happening and how is that different from what is called acute pain, and more importantly, what you as a parent can do to help your teen get out of this chronic pain condition. So let's dive in. Hi, my name is Dr. Lee. I'm a pediatric health psychologist and the founder of Teen FND Academy, which is an online coaching program to help teens with FND that includes chronic pain and their parents get their lives back, basically, because they are done with all these symptoms. So I want to talk to you about one of the teens that I have worked with in the past. Let's just say her name was Leila. She was 15 years old when her family found me, but by then, this pain literally took over her life. She couldn't walk down the street without crying from pain. Her pain was so unpredictable. It was all day, every day, consistent and persistent. But then also she had these spikes in headaches and in pain flare-ups. It was so unbearable to the point that she had to stop her life. Like going to school was out of the question. And doing the sports activities, don't even bother. Her family went to specialist after specialist because they were so worried sick. What's going on with Leila's condition? But nothing really showed up on imaging, maybe some inflammation here and there, but nothing really to explain what was going on. And they started going to this rabbit hole of seeing so many different doctors and providers. And then when they actually said 20, 30, 40 different things. So now Leila was living with this so many different diagnoses or reasons and all kinds of things, including it's gotta be anxiety. And she's just so stressed out. You need to basically get rid of her stress. Then the pain is going to be better. Whether it's a stress related to school, or sports, or friends, life, you name it. That's the only thing that family can do. So parents started removing all kinds of so-called stress, or what they thought was stress, out of Leila's life. And she was basically bedbound and feeling like a zombie because she was in pain so much and she just couldn't do anything. And every day goes by, Leila was feeling like there was something completely wrong with her and she felt so broken inside of her. And that's the condition when I met with this family. And she, of all the things, also had other FND symptoms like functional seizures and drop attacks and brain fogs, which I covered in the video somewhere on this channel. But if your teen is also experiencing chronic pain, just keep watching and make sure to hit subscribe and like button and then share this video with all of your doctors that you have seen, just like Leila. Now, chronic pain is really kind of mysterious thing. Even though we all know what pain is and how pain feels, even though that everyone has a different variations of what that pain level looks like and it feels like. So essentially, this is what I did. I taught Leila and her parents how chronic pain works, especially within the context of FND. Oh, by the way, FND stands for functional neurological disorder, which is a legitimate condition and it's a real disorder. And essentially is the umbrella term to describe these cross-wired problems between the brain and the body, even though your child, Leila included, brain and the body are physiologically and structurally fine. That's why they could not find anything in the imaging, scan, CT, MRI, EEG, blood work, all kinds of tests that you can imagine, couldn't find anything. But basically what it is FND is a condition where Leila's brain and body are sort of stuck in this danger detection mode and either a fight or flight too much or frozen. And so her body and the brain were going like a ping pong, back and forth, fight and flight, or fight or flight, and then froze him, to the point it was basically sending these false alarms, like there is a fire alarm going when there was no fire. Mind you, no, Leila did not make things up. So if you're still thinking, if we can find anything, it must be in their head, stop saying that, because brain is in your head. That's about it, okay? However, the interesting thing is the pain is all coming from, not in their head, but coming from the central nervous system, which is the brain and the spinal cord. So basically, this is what I did to help Leila and her parents. First of all, they needed to know what chronic pain was, right? Unlike acute pain, which is a sign of injury. So if you get a paper cut and then bleeding and ouch, that is acute pain. It's a sign of injury because there is a structural damage and the structural tissue damage, right? So that is acute pain. The chronic pain is a condition in and of itself, with or without an injury. Now, someone like Leila, like a lot of other teens that I work with, they have had some sort of illness or injury. Maybe it's a concussion or something happened, some sort of injury. And then injury itself has healed, but then the pain consistently persisted, and that eventually became a chronic pain. So a lot of people still think, and naturally speaking, right, the pain is still there. That means the injury has not healed, when in fact it's not true. And this is where a lot of families get confused in this conventional medical model, where they're excellent at treating acute condition, including acute pain. However, when things get chronic, doesn't mean permanent, but chronic, like long term, including chronic pain and FND, they don't really have anything to fix. That's why the solution is not in that conventional medical model. However, back to the chronic pain. So by definition, chronic pain is the pain somewhat lasting for a long time. And then when they say long time, it could be anywhere between 3 to 6 months or more. And the pain has to be present for at least half the time. So like half the month, or plus. So Leila definitely met that criteria, because she was having this consistent, daily, persistent pain for months and months and months. And sometimes it's caused by an injury, as I mentioned, or some sort of illness. However, Leila didn't have any. She was fine until like one day, bam, this pain happened out of nowhere. And then the pain is interfering with that person's ability to have the daily activities, like Leila. So when you have those two things, pain lasting for long enough time, and then the pain is basically in a way of living your life, then yeah, you join this club of chronic pain that you didn't sign up for, just like Leila. And Leila also needed to learn how the pain is created. So in a super simple term, the pain is basically your brain and the spinal cord's interpretation of what they think is happening. Again, there is a difference between acute pain and a chronic pain, so they're not the same thing. So if you are going to comment here, well, if you bust, your knee, then you should feel the pain. Yeah, of course, that's acute pain. So it's not the same thing as a chronic pain. Anyway, so essentially what's happening is that your brain and the body somehow get stuck in this cycle of fight or flight. And that's essentially what's happening with the chronic pain experience. Is it real? Oh, absolutely. All pains are real. And also all pains are 100% biological, emotional, and social. So when these doctors said, Leila's doctor said, oh yeah, it's got to be stress. You need to take the stress out of her life. There's a certain truth to it, because again, chronic pain is biopsychosocial thing. And so the stress can be coming from psychological or social components, right? And it's not like that Leila had an anxiety or any psychiatric illness or anything like that, but the stress, is a response to something that is happening. And so to a certain degree, yes, that would be helpful. But then removing her from those conditions or stress is not really a solution, because it's a temporary fix. Because essentially Leila didn't learn how to deal with the stress. If basically her parents keep removing all the stress out of her, right? So she learns how to prevent it and how to detect when the stress is coming, but she doesn't really know how to deal with it unless her parents are going to be there to remove that stress or obstacle every single time, which is not really feasible. So I had to teach her and her parents what you have been taught, what you have been led to believe, and what you have been doing and not really working. And what she needed to do was she needed to learn basically the skills and strategies, what I call it, doing the right thing with the right mindset, to make her brain feel safe again. So then the brain does not need to continue to have this fire alarm when there is no fire. Of course, little by little, baby steps, and really focusing on pain, essentially reprocessing strategies. So starting with re-regulating the autonomic nervous system, right? A lot of relaxation and calming strategies, not only when she needs to do, but on a regular basis. So she's really building a strong foundation to get used to and then be really good at those skills and strategies. So then she can feel like her pain is part of the process, that she just needed to retrain her brain and her body. And she is also rebuilding the trust in her body. Because I always teach in my online program, Teen FND Academy, teens really need to have these two things. Without it, not going to be done with chronic pain or FND. One is a sense of control, like the empowerment part. And so as long as the parents are like hovering and over accommodating, then you're taking that power out of the child. So that's like going backwards from recovering, right? And then the second part is the self-awareness. Not just about like, oh my gosh, my pain is going to be bad. Not just that, but everything else. You know, how is she feeling in any moment? And how is she feeling present? So having a lot of grounding techniques was really helpful for her. And how is she actually feeling? You know, her emotion-wise, can she articulate and can she communicate that? All of that stuff was really important as part of the self-awareness. So she learned all of those strategies to regain that sense of power and the self-control and self-awareness, and then she got better. So today, even within 2 months of joining the program, Teen FND Academy, she has been having this pain for months, if not years, and she had a zero, no pain whatsoever. And she stopped taking all of pain-related medications because she knew they were not doing anything consistently. So I'm not saying get rid of your medications today, because you need to have skills and strategies with the right mindset and with the right knowledge and education about what you're dealing with, right? So that's not what I'm saying. Like, you know, so of course you need to work with your doctor who's prescribing all the medications. So what can you do instead? Obviously, you can talk to the doctor about what else could we do, right? However, as a parent, start asking different questions if you are doing this already. Instead of asking your child, how much does it hurt? What's your pain level? How are you doing? Maybe you should do this. Oh, did you take this medication? Maybe you should rest and drink water and all of this stuff. Stop. It's called status check questions. Stop doing that. Instead, validate and then punt it back. So I call it the VP steps. One is validate. If your child is seemingly having pain or tell you that she isn't having pain, then you validate. Oh, I'm so sorry you're having this. It sucks that you're in pain. And then P, punt it back. What did you do to help yourself? What are you doing to help yourself? And if the child goes, I don't know, then okay, take your time. And when you are feeling a little bit better, then we can talk about it. So you can absolutely start there. And if you want to be more proactive, you can have a conversation with your child ahead of the time before you change your strategies, because that can feel weird for your teen. Like, what's wrong with you kind of thing, right? So you can have a conversation with your teen about, hey, I watched this video and it seems like we are not doing the right thing to help you. So we want to be good parents and also effective parents. Therefore, we're going to be doing things a little bit different. Like, we're not going to ask you about your pain level anymore, because putting more attention actually is a gasoline to the fire. So we want to put out the fire. So that's what we're going to be doing. And then we're not going to be even suggesting what you should be doing when you're in pain. The only exception is a medication dispensary, right? So I don't want your teen to go into the, like a cabinet or medicine cabinet pantry or whatever, and start taking a whatever medication. So you still need to manage that. But other than that, you guys can also write down the things that helps on the list, basically a piece of paper, and then your teen can refer to that. So then if and when your teen has just tons of pain, nobody can think straight. So you can have a list, and then all they have to do is like, oh, I can do this, I can do that on their own, right? Again, the empowerment. So that would be really, really helpful. And number two, you as a parent, you can also have this preemptive conversation with your teen. Gotta start focusing on the functioning, like a daily activity functioning, not the pain. See, here's the thing. With the chronic pain, also FND, the sign of progress is 100%, not 99%. 100% measured by how much your teen is getting back to the life they want or they once had, and how much they believe they can control themselves. Not so much of how much believe they can control about their pain, but no, to get back to the life. So it has nothing to do with the pain level. Again, as soon as we start focusing on the pain level, or the reduction of the pain, whether it's a frequency or intensity, it doesn't matter. As long as you're stuck on that, then you are choosing to pour the gasoline to the fire of chronic pain. Now, if you want to stay and then having this chronic pain in your life for the rest of your life, that includes witnessing your child continue to suffer, by all means, continue to really focus on the pain. But if you're like, you know what? We are done with staying in this club. We're ready to exit this club of chronic pain. Then start acting, focusing more on the functioning, and celebrate small wins, whether it's a big or small. It doesn't matter. You are going to go through one step forward and two steps backwards, especially in the beginning. But that means that your child is doing something manually right thing with the right mindset to get out of the club. So don't stop, just keep going. But that doesn't mean like your child needs to like go and crush and burn. Your child needs to pace herself, and then let your team pretty much borrow your belief that she can get better. So doing the right thing with the right mindset is absolutely critical. Your child can be doing this right thing all day, every day, but if the mindset is not there, might as well just cancel with each other. Now, if you are ready to help your teen, and if your teen is really ready to be done with this chronic pain camp, then you really want to get the real result, then I would say you might want to check out Teen FND Academy. The link is down below, and see if you qualify for the program. Now, also leave me a comment. I want to hear what kind of chronic pain your child has had and what has been done so far, because I always read everyone's comment. Now, thank you so much for watching this video, and I will see you in the next video.